Why is it important to understand trauma in any integrated care system?
Because of the complexity, particularly early adversity, early trauma in the lives of people affects the developing brain and body in a number of ways. It adversely affects their hormonal system. It adversely affects their immune system. It changes how genetics get expressed. It creates neural pathways that are what we call, they become potentiatedly reactive. In other words, they're used so much that they're easy to access, and the natural tendency is to overutilize those pathways, and those pathways usually are generally related to stress and anxiety related patterning. So as we kind of move through that process, having a history of adversity and you're going into any system, if people are not aware that there are these complications, they're going to misdiagnose or oversee things that are apparent. Like we have a significant number of children that struggle with relatively severe asthma. And we've known this since 1964 through 67, when Salvador Minuchin was working with children in the slums of Philadelphia, that you would get an exacerbation of asthma when there was greater levels of stress in the home environment, or when there was greater level of conflict between the parents or the adults in that child's life. You had a much greater likelihood of having severe asthma and also some additional allergies. We also know that early history of adversity, because of the adversive childhood experiences that were published in 1997, we know that there is real health risks. You're at greater risk for heart disease and all sorts of pulmonary problems. You're at greater risk for Alzheimer's and MS and chronic fatigue and a whole host of immunosuppressant types of behaviors, certain kinds of arthritis, all related to having these changes occur in a developing body. Because once those changes are made during that developmental period, we don't have really sophisticated ways to undo them. And so when you look at the risk factors of a child that has insecure attachments, they have relatively aggressive families, there's some domestic violence, there's the use of any kind of compulsive or addictive behavior, if you see any kind of sexual violence or neglect, as you start kind of getting a preponderance of these, the effect on the body is so pervasive that it affects people's health for 50, 60 years after that. Even if they are moved out of that environment, the effect has changed their system. Some of that research that's now coming out is actually saying things that happen in the earliest part of the prenatal experience are creating behaviors that are predictable at 5 and 6 years old. And then we also have a whole bunch of new science that really kind of grew out of the work of Marcus Pimbry, and he was a pediatric geneticist that was in charge of pediatric genetic diseases for the Human Genome Project. He discovered that you could have a human being with a deficit, a single deficit. We could recognize a single genetic deficit, and it should yield a predictable disease, and it didn't. And it kind of flummoxed their whole team. And so you have this large team of geneticists trying to figure out what's going on. And what eventually emerged from that was that the history of going back 3 and 4 generations was more predictive of which disease was going to be emergent than the deficit in that individual. And there's been a host of research since then. Out of Israel, last summer there was a study published that looked at a certain form of cancer that has emerged that is only found really in families of Holocaust survivors. To children that were conceived post-Holocaust, Holocaust survivors have a very high likelihood of having this particular kind of cancer. And so it's opened up the idea that it's not just what happens to you in your prenatal or infancy, but also what happened in your family going back 2 and 3 generations. So this is how important is it to have stable early life is incredibly important, and it's important to maintain that for generations.